AFMC is really known.
That this video will provide ideas
And also make sure
between the office hours.
Welcome to this edition of AFMC TV. I'm Robin Ledbetter. Thank you so much for joining us. Today I have with me Miss Joy Gray, and Joy is the branch chief of the Tobacco Prevention and Cessation Program for the state of Arkansas. Yes. Thank you so much, Joy, for joining us.
Thanks for having me. I'm glad to be here.
Yeah, me too. So tell me about the BeWell Arkansas call center. What is it and what is it for?
So the BeWell Arkansas program, it is located at the Arkansas Department of Health. And what it is the tobacco cessation program for the state of Arkansas. So if you want to quit smoking, vaping, dipping, any type of nicotine, you give us a call and we will help you quit.
So when people call in, are they talking to someone in Arkansas?
They are. We are actually the only quit line in the entire nation that's operated in state by a state agency. So when you call BeWell Arkansas, you're talking to someone right here in Little Rock that works in my office.
So who can participate in the actual call center?
Anyone whose ages 13 and up can give us a call if they're addicted to any form of nicotine. Now, we do provide free counseling for everybody that calls, and then we provide free nicotine patches and lozenges for people who are aged 18 and up, or you have to also weigh over 100 pounds. So as long as you meet those criteria, you can get your free nicotine patches. If you're under 18, then obviously we only provide the counseling services, but a lot of people find that that works just as well for them.
And you use an ask, advise, refer model.
Right.
What does that mean?
So what we do, in addition to working directly with patients, is we try to go out in the field and talk to doctors, nurses, any kind of clinician that's out there that might interface with the patient who's a smoker. And so what we try to teach them is how to ask, advise, and refer, which is ask the question about tobacco use. Are you using any form of tobacco, including vaping? Because it is also very, very bad. It is not good. And then you advise them on all the ways that they could do better with their health if they would quit, So not just the doom and gloom parts, but also you could be a lot healthier, you could be more active, you could get out and do more things if you were to quit smoking. And then the refer piece is just saying, call BeWell Arkansas. Here's the phone number, here's the website, and later on we can talk about some of the materials that doctors and clinicians can give out so that they can take it home and when they're ready, give us a call.
And it's not just a traditional doctor per se, providers within the state. You serve veterinarians, dental offices. How does that work?
Well, we've created materials for all sorts of non-traditional partners because we find people have a lot of reasons for wanting to quit. And sometimes it is because maybe they just got brand new porcelain veneers and they don't want to get them stained. They want to quit. Those dentist offices are a great place for someone to realize, hey, I can call BeWell and I can quit. Veterinarians offices, your dog or your cat, your bird can get sick from your secondhand smoke. And so we've created materials to post up in vets' offices, and vets have given us great feedback. They said this really opens the door for me to talk to my clients about it, and they don't feel judged. They don't feel like I'm talking down to them, and they realize that it can make their pet sick. And so they give us a call and they say, hey, I saw this in my vet's office and I don't want to make my dog sick, so I want to quit. So yeah, whatever kind of office you have, or it can be your business. If you're just someone who runs a mom and pop grocery store and wants your staff to quit, or you want your customers to be healthy, we can help you put things up or give things out so that people know where they can call.
Is that part of your worksite wellness program?
Yes. So we do also help anywhere that wants to talk about worksite wellness can give us a call, and we'll talk to them about different ways that they can offer incentives to get their staff to be healthier, to quit smoking. Because if you have a staff that doesn't smoke, then you're using less sick days. You're sometimes getting cheaper insurance premiums, and you just have an overall healthier, happier, better, more, functional staff. So we definitely encourage people, if you want to talk about some ways you can incorporate it, because it's not just for patients and people that are at a patient level. If you're a doctor and you're smoking and you want to quit, call us. If your nurses are smoking, have them call us. We can help anybody. If you run, like I said, a grocery store, a gas station, any kind of company that's out there, you can give us a call and we can tell you how to promote this to your employees.
And it's not just lung cancer, right? These all kinds of health conditions that this applies to.
Absolutely. And we've done a good job of telling people about lung cancer and how smoking causes lung cancer, but it causes heart disease. It causes your arteries to shrink up, it causes your blood to thicken so it can't flow through your body very well. People who smoke combustible cigarettes are 30 to 40% more likely to develop type 2 diabetes. And people just don't realize that. Everything from your skin all the way into the rest of your body is impacted when you smoke or vape. And so there's just, any day's a good day to quit. There's no reason to keep doing it. Today's the day.
So tell me about menthol protocol. What is that?
So we decided last year, after we had attended a big CDC event, that menthol cigarettes are a big enough issue that we need to create kind of an extra little program for our menthol smokers. So if you call BeWell Arkansas and you identify as a menthol smoker, you get extra counseling and extra nicotine replacement therapy, or NRTs. And we did that because menthol is easier to get addicted to and it's harder to quit. They make it where it tastes better, it's a little more palatable, and so people get addicted very, very easily to it, and it's just so hard for them to quit. So we want to offer those people just a little bit of extra help so that they can quit more easily.
So there is also something for expectant mothers, BeWell
Yes.
Baby. Tell me what that is.
Yes. So we have a whole separate program for pregnant smokers. So if you're pregnant and you're smoking, you need to quit. It is 100% safe to quit smoking while you're pregnant. I know there's a myth out there that it's not, but it is. And what we can do is help you. And what we do is we provide them with counseling and we provide them with vouchers. As they matriculate through the program, they earn vouchers for free diapers and free wipes redeemable at Walmart and Walmart.com. And it helps them to, talk to someone, talk through the process, identify their triggers, talk about why they need to quit, why it's better for their baby, and then they can also earn incentives along the way. And if they live with someone who smokes, that person can also enroll and they can also earn diaper vouchers. So if both people enroll and complete the whole program, they would earn $400 worth of diaper vouchers, which I know for babies, $400, it's nothing to sneeze at.
I don't know. That sounds pretty good.
I know. Some babies maybe go through it in a week, but that's still a week's worth of diapers you're not buying. So
That's a really great program.
Yeah,
and the
that's
partnership
really
you
great.
said is with Walmart.
yes.
Yep. Very cool. So you provide twice a year tobacco treatments training free of charge. What does that mean?
So what that means is if you're someone who works with people who might be smokers, and that could be anyone from a doctor, it could be a nurse, a respiratory therapist, it could be someone who has a mental health licensure of some sort, or it could just be someone who has a high school diploma and is working the front desk at a doctor's office, but interfaces with those patients. We provide trainings twice a year. They're free through the health department. They do provide continuing education credits if you have a licensure that's in the medical field. And it's a week-long program, and it's called Tobacco Treatment Specialist, or TTS. And it teaches people how to talk to people about tobacco, everything from motivational interviewing to pharmacology, drug interactions. You really learn all of it so that you can have a good, competent conversation with people about quitting. And it may be that you aren't going to use it as a billable service in your practice, but it's just good information to have and a good knowledge base to speak from when you're talking to people about tobacco.
Well, it sounds like it's very versatile for all kinds of health professionals then,
Right.
across the state.
Absolutely. Absolutely. And we do it twice a year. And it is, like I said, totally free. If you were to take this course yourself, it would be about $1,500 per person. But we cover the cost of all of it. And it's through the University of Texas MD Anderson Cancer Center.
Sounds really worthwhile.
Yeah,
for sure.
it's a good program.
So what tools are available to those who want to stop smoking? You mentioned there's a website.
Right. So you can go to BeWellArkansas.org, or you can call 1-833-283-WELL. That's 1-833-283-9355, and give us a call, and we can help you quit anytime. If you're a provider or just someone that wants to have materials, we have things like this. So we have these nice little cards that can be handed out. Go to BeWellArkansas.org, and there's a button at the top that says healthcare provider. When you click it, it takes you to a little button that says free resources. You can order any kinds of cards, posters. We have lanyards, magnets, all sorts of cool stuff that we give out, and we ship it free all across the state of Arkansas. So when you do that Ask, Advise, Refer, and you say, hey, are you a smoker? Here's all the reasons you should quit. When you're ready, call this number. That's all you have to do. It is that easy. We have done everything we can to make it super simple and easy. We have all sorts of stuff, and it's totally free.
Really cool resources, really usable resources that can be used for any type of healthcare provider.
Right, exactly. Any kind.
Right. That's great. So what should our viewers do if they want to learn more, if they want to be a part of this, if they want to get resources? What's the first step that you suggest they do?
So if someone is any sort of clinician or has any sort of, clinic or facility, they're welcome. They can just give me a call directly. And again, my name is Joy Gray. I'm sure we'll see it on the screen somewhere, but my number is 501-661-2042. And I'm at the health department pretty much every day. Feel free to give me a call, and we can get started on how you can help your worksite be well, how you can help your patients be well, and how we can get you some of these materials, anything that you need to know about making sure your patients and that your clientele are aware of this. We're here for you, and we're here to help people do that.
Such great information, Joy.
Thank you.
And so if there's one last moment of messaging that you would like our audience to know, what would that be?
It would be that anybody in Arkansas can call 1-833-283-WELL and we can help you quit for free.
Well, thank you. Really great information. And I hope that all providers across the state take advantage of this really amazing program.
Awesome. Well, thank you for having us.
Yeah. So that's it for this episode of AFMC TV. Have a great day and thanks for watching.